Hello, and a very warm welcome to Advanced Dermatologic Surgery. If you're listening to this explainer, you or a loved one have likely just had a retroauricular interpolation flap procedure. First off, take a deep breath. You made it through the surgery. Now it's time to focus on healing. I'm here to guide you through your post-operative care. We totally get that caring for a surgical site at home can feel a little intimidating, but honestly, we've broken the whole thing down into a very manageable, structured plan. You are in great hands. Just follow along with what we cover today, and you'll be setting yourself up for a really safe and successful recovery.
So here is our 5-step roadmap to healing. We're going to cover bleeding and immediate care, daily care and hygiene, activity and lifestyle restrictions, medications and pain management, and finally, warning signs of complications. Let's just take this one step at a time.
All right, step 1, bleeding and immediate care and what to expect in the first 48 hours.
Now, the most important thing I want to convey right off the bat is reassurance. It's so common to feel anxious if you see blood, right? But bleeding is completely normal and totally expected for the first 24 to 48 hours. In fact, your bandage might get completely saturated or even leak a little bit during this time. Please don't panic, it's just a normal part of the early healing phase. If you do have bleeding, you need to press firmly and directly right over the bandage with gauze, a clean paper towel, or a washcloth for a full 30 minutes. And here is the absolute key rule, and it's a tough one because human nature just makes us want to check on it. You have to hold that pressure without lifting up to peak. Literally set a timer on your phone for 30 minutes. No peeking. You might actually need to repeat this a few times before the bleeding fully stops, and that's perfectly fine. Just don't remove the bandage while you're doing it. Now, if after several back-to-back 30-minute attempts it still hasn't stopped, well, that's the time to give our office a call. Let's talk about the bandage you're wearing right now. It's a large, bulky white bandage made of gauze and tape. It's intentionally bulky to help control bleeding and protect the surgical site. The golden rule: keep it in place and keep it dry until your follow-up appointment. If it gets completely soaked with blood in that first 24 hours, just call us and we'll schedule a bandage change. Otherwise, let our office handle your weekly bandage changes. Remember, this procedure happens in 2 stages, which means a really delicate bridge of tissue is currently connected so your new skin keeps its blood supply. That bulky bandage is protecting that bridge, so let the pros handle taking it on and off.
Moving on to step 2, daily care and hygiene, and some simple steps for home care.
Like we just said, ideally the office handles the bandage. But, life happens. If it accidentally falls off on its own, call our office right away. In the meantime, you'll need to step in and do a daily wound care routine until you can come in. It's super simple. Step 1, always wash your hands thoroughly before touching the area. Step 2, gently clean the incision along with any visible stitches or staples using mild soap and water. Step 3, apply a generous amount of Vaseline. In step 4, cover it with a clean bandage. Any standard bandage you have at home works just fine. But please listen closely to this. Never remove, adjust, or manipulate that bridge of skin between your neck and ear. That tissue is the literal lifeline for your healing skin, so be incredibly gentle. Okay, step 3. Activity and lifestyle restrictions. Basically, how to rest and heal safely. What's really interesting here is how your resting posture actively helps you heal. Rest is practically part of your prescription. For the first 48 hours, keep your head raised, grab a few extra pillows, or sleep in a recliner. When you do sleep, make sure it's on the opposite side of your body from the incision. Light walking? Totally fine and actually good for you. On the flip side, do not put ice directly on the incision for the first 48 hours. Bruising, swelling, and color changes are totally normal. You can ice around the area, like near your eyes, just never directly on the wound. You also need to strictly avoid heavy lifting, intense cardio, bending over, and pretty much any strenuous activities. Basically, avoid anything that raises your blood pressure or stretches the repair until you're officially cleared. And finally, avoid blowing your nose or doing anything that might pull on that flap of tissue. Let's look at step 4. Medications and pain management. Keeping you comfortable is a huge priority for us. First, some great news. You can go ahead and resume all your usual medications right now, both over-the-counter and prescription. For pain relief, over-the-counter meds work incredibly well. The protocol is to take 2 extra-strength Tylenol, which is acetaminophen, and 1 to 2 ibuprofen, like Advil or Motrin. As long as you don't have a medical condition preventing it, you can take these together every 6 hours. Just follow the bottles. Also, if a nurse prescribed an antibiotic, please pick it up and take it exactly as directed. Quick pro tip, though, take it with food so you don't get an upset stomach. If you do have a reaction to it, just skip the next dose and give us a call. Now, regarding skincare, the rule is very straightforward. Do not resume sunscreen, makeup, or scar reduction products at this time. You really want to let the surgical site breathe and heal naturally under its dressing. We'll give you plenty of detailed instructions on when and how to restart those things at your next appointment. And just like that, we are at the fifth and final step of our roadmap.
Step 5. Warning signs of complications and when to reach out.
Knowing what to look for doesn't have to be scary. It's actually the best way to feel empowered and safe at home. Infections are pretty uncommon, but if they do happen, it's usually between days 3 and 7. Keep an eye out for a fever over 104 degrees Fahrenheit, chills, spreading redness, warmth, swelling, thick yellow or green drainage, or pain that suddenly gets worse after it was improving. If you see any of that, call us. Next, allergic reactions. If you're feeling intense itching and see bright redness near the tape, you might just be sensitive to the bandage. If that happens, you can take the bandage off and call the office for next steps. And of course, like we mentioned earlier, if you have persistent bleeding that just won't stop even after a few solid 30-minute sessions of firm pressure, that's a definite sign to call us.
And that wraps up our explainer. Remember, this is a 2-stage process. Your second stage or takedown surgery will be in about 3 weeks, and you'll get a brand new set of instructions then. Until then, just rest up and follow these steps. Please contact our office with any questions or concerns whatsoever. We're here for you. So, as you settle into rest today, what's the one small adjustment you can make right now to ensure you stay as comfortable as possible? Wishing you an incredibly smooth healing journey.